Performing physical assessment of the ear. So, purpose to evaluate the condition of external ear, the condition and patency of ear canal, the status of tympanic membrane, bone and air conduction of the sound vibration. So, hearing acuity and equilibrium. So, the equipment are watch with a second hand for Rumbridge test, and tuning fork, and lastly, otoscope. So, general consideration. Recognize the role of hearing in communication and adaptation to the environment, particularly to in regard in aging. So, number 2, know how to use otoscope effectively when performing the ear examination. So, before the test, make sure the client sit comfortably and explain the procedure on what will you do to ease the anxiety of the patient. So, suggested action for external ear structure. So, number 1, inspect for auricle, tragus, and lobules. So, normal findings. So, ear are equal in size bilaterally. Normal is 4 cm to 10 cm. So, the auricle align with each eye, corner of the eye, and within 10 degree angle of the vertical position. The skin is smooth, no lesion, lumps, or nodules. So, the color is consistent with the facial color. So, abnormal findings. Ear are smaller than 4 cm or larger than 10 cm. So, misaligned or low set ear, ulcerated, and crusted nodules that bleed. Redness, swelling, scaling, or itching is present. So, enlargement of the preauricular and postauricular lymph nodes. Number 2, palpate for the auricle and mastoid process for tenderness. So, normal findings. Auricle, tragus, and mastoid process are not tender. So, abnormal findings. Auricle, painful auricle or tragus, and tenderness over the mastoid process and behind the ear. So, otoscope examination. Number 1, inspect the external auditory canals. So, normal findings are a small amount of cerumen or earwax is the only discharge normally present. Canal walls should be pink and smooth without nodules. And abnormal findings: foul smelling, sticky yellow discharge, bloody purulent discharge, reddened swollen canals, exostosis, or polyps. Number 2, inspect for tympanic membrane. So, tympanic membrane may appear pearly, gray, shiny, and translucent with no bulging or retraction. It is concave, smooth, and intact. The older client eardrum may appear cloudy or landmarks are more prominent. So, abnormal findings. So, red, bulging eardrums and distorted, diminished, or absent light reflex. So, hearing and equilibrium test. Number 1, perform the hearing test. By normal findings is the patient can hear your whisper. And number 2, the patient cannot hear the whisper on the other side. Next will be number 2, perform the rhyme test. So, normal findings. Air conduction is normally heard longer than bone conduction. So, abnormal finding, bone conduction sound is heard longer than air conduction sound. So, number 2, perform the Weber test. So, normal findings. Vibration is normally heard equally in both ears. So, no lateration of the sound in either ear. So, abnormal findings. The patient reports that lateration of the sound in the poor ear. That is, the client hears the sound to the poor ear. Number 4, perform the Rumbridge test. So, normal findings. The client maintained the position for 20 seconds without swaying or minimal swaying. So, abnormal findings. The client moves feet apart to prevent from falling, or the client start loss of balance. After the test, formulate nursing diagnosis, wellness, rest, and referrals. Number 2, formulate the collaborative problems. Number 3, make referrals. So, hello sir. Today po, I'll going to assist your ear. So, first po, I'll check your ear size. So, next will be the other side. So, for the shape. So, next will be the color. So next will be step 2, palpate for mastoid, bone, and auricle. So, sir, I'll touch here po. Sabihin niyo po kung may masakit po. Tapos po i-rate niyo 1 to 10. So, dito po, sir. Dito po. So, sa kabila po. Dito po, sir. Dito po. So, next will be, I'm going to use otoscope. I'm going to use otoscope for inspection of your inner canal po. So, here po, sir, I'm going to check your ear po. So, sa side po. Okay. So, next po is, I'm going to inspect your eardrums. So, okay. So, next will be hearing and equilibrium test. So, sir, pakitakpan po sa kabilang yung ear. Ay, sa ako na lang po. So, may sasabihin po ako, tapos uulitin niyo po. Mag-whisper po ako. So, yun na po. Ano po yun? Apple. So, next po sa kabila. Okay, so for the next will be the ring test. So, sir. Sabihin niyo po kung kailan po tumigil yung vibration po. Wala na po? So, ulitin po natin ha. Okay po. So, next will be, so again po, ano niyo po kung kailan po tumigil yung vibration po. So, okay po. So, sa kabila po tayo. Po. Okay. So, our next po is the Webner test. So, sir, sabihin niyo po kung saan niyo maririnig yung vibration po na malakas or mahina po. So, pantay naman po. Okay po. So, 1, 2, 3, go. So, sir, close your feet po. Yan po. Tapos po, open eyes lang po. So, 1, 2, 3, go po. So, sir, next, ano po, close eyes po. 1, 2, 3, go po. So, okay po. So, yun na po.